Hello, I would like to introduce you to a plan to provide affordable health care to all Americans. Can America's healthcare system provide affordable health care to all Americans without America going broke? Yes, I believe that it can. The goal of this video is to explain how everybody in America can have access to affordable, high-quality health care for years to come, where every person in America in need of medical care is treated with dignity and compassion and given personal attention regardless of their social or economic status, while at the same time, America's healthcare system becomes more of an asset to America and less of a financial liability. If you ask people today what they think about the American healthcare system, here are some of the answers you would get. It's okay, or we should have a healthcare system like Canada, or my premiums are too high, or my deductibles or copays don't add up, or I can't get the type of coverage I really want. My doctor stopped taking my insurance carrier. My insurance carrier takes too long to reimburse me. I can't find a doctor close by for my condition. I'm always on the phone waiting to speak to someone. The waiting room is always full of sick people, or we can't afford the insurance. This is just a small sample of what people have to say about America's healthcare system. But not all people have bad things to say about America's healthcare system. Many people have good things to say about the healthcare services they received. Whether you are completely satisfied, dissatisfied, or somewhere in between, when it comes to healthcare, one thing is certain. We all need it. And in America today, there should be no reason for anyone to feel helpless or lost while seeking medical care. The country cannot afford to pay for everyone's medical needs. This is true. But the U.S. government can help make sure everyone in America receives affordable, high-quality medical care when they need it. And the government can make its healthcare system become more of an asset to America and less of a financial liability. The U.S. government just needs to make some changes to how it handles both its healthcare system and financing to make this possible. The U.S. government spent approximately $1.1 trillion on healthcare costs in 2018. Where do healthcare dollars get spent by the government? The two major healthcare programs used by the government are Medicare for the elderly and Medicaid for the low income. The U.S. government currently provides healthcare insurance to approximately 38% of all the people in our country. This is why the government cannot afford to pay for everyone's healthcare insurance. It can barely afford to pay for 38% of everyone's healthcare costs right now. In 2018, the U.S. government had these financial liabilities to the people: $1.1 trillion for healthcare, $1 trillion for Social Security, $900 billion for defense, and $500 billion for all else. Our plan focuses on healthcare costs. What someone is willing to pay for something is impacted by the supply and the demand for that product or service. If there is a larger supply than demand available for something that people need or want, this produces downward pressure on prices. This is amplified when more sellers are competing to sell their products or services. Most people can relate to this when shopping for products or services. If there is a larger demand than supply for something that people need or want, this produces upward pressure on prices. And the more buyers competing to buy a product or service, the higher the price goes. Now, let's look again at the impact supply and demand has on costs and prices. If the number of buyers is the same as the number of sellers, there really is no particular pricing pressure up or down. If there are more buyers than sellers for a particular product or service, then there is pressure on prices to go up. If there are more sellers than buyers for a particular product or service, then there is pressure on prices to go down. Our plan is to first start increasing the supply of healthcare products and service providers to equal the demand for them and stabilize healthcare costs. Then, increase the supply of healthcare products and service providers further to begin reducing their costs. Our plan to reduce healthcare costs starts by increasing the supply of healthcare products and services faster than the demand for them, consistently each year over the next 10 to 20 years. Now we're ready to discuss supply and demand for healthcare. And we will start with the demand for healthcare. Because we have an increasing population with an increasing life expectancy, we will have an increasing demand for healthcare products and services. For our plan, the demand for healthcare is not negotiable. It's not going down, and it's not staying the same. It's only going up. For our plan, we will embrace this increasing demand and work towards providing everyone in America in need of medical care with a level of service far better than they have access to today. In 2008, the U.S. government spent $671 billion on healthcare. In 2018, the U.S. government spent $1.1 trillion on healthcare. That's a 10-year average annual increase of 6.5%. The population in America right now is approximately 330 million people, with 56 million of those people over age 65. We identify people over age 65 because, statistically, they require more medical services than those who are younger. In 2030, the population is projected to be 355 million people, with 73 million people over age 65. And in 2040, the population is projected to be 373 million people, with 80 million people over age 65. This leads us to make the following projections and assumptions for government spending on healthcare over the next 20 years. Over the next 5 years, there is no reason to think an annual increase of 6.5% won't continue. 5 years after that, we will assume government spending on healthcare will likely increase annually at 7%. For the next 5 years, we will assume annual spending will increase 7.5% and 8% for the next 5 years. These projections seem reasonable, given what the government has been spending and what the demographics of the population look like. But talking about percentages isn't as meaningful as talking about dollars. Starting with the $1.1 trillion spent in 2018, a 6.5% annual increase for the next 5 years adds up to $6.7 trillion. A 7% annual increase for the next 5 years adds up to $9.3 trillion. A 7.5% annual increase for the next 5 years adds up to $13.2 trillion. And an 8% annual increase for the next 5 years adds up to $19.2 trillion. When you add up each of these, that's a total of $48.4 trillion projected that the U.S. government will spend on healthcare over the next 20 years. This is a lot of money. Spending this much money on just healthcare puts America's own financial health at risk. Our plan is to provide everyone in America with high-quality, affordable healthcare for less money than this. The goal for our plan is to reduce these healthcare costs to the government by as much as 50%, while significantly increasing the quality of medical service each person in this country receives or has access to. So, let's get started with our plan. We identified the fact that the U.S. government has increased its spending on healthcare by an average of 6.5% each year over the last 10 years. Over the last 10 years, the U.S. Medical Care Inflation Rate Index had an average increase of 3% each year. What's the difference between these two numbers? The difference is that the 3% inflation rate is part of the 6.5%. This is because there are two parts to spending increases. The first is the increase of the costs for what you are purchasing, and the second is for the increased number of purchases. While the average increased spending for the last 10 years was 6.5%, 3% came from inflation. That's the increased costs of the healthcare products and services being purchased, and 3.5% was for the increased number of purchases, which represents more people in need of medical care. Most people can understand that when their costs go up, they are either buying more of something and/or what they're buying is increasing in cost. Sometimes people buy the same amount of something, but prices are still increasing. Sometimes people are buying more of something and spending more, but the prices of what they're buying aren't increasing, at least not at the moment. So, our plan separates these two parts of the spending increases to address how to reduce each of them. Now, we go back to our projections and separate the spending increases between inflation and the number of purchases. Our plan to reduce government spending on healthcare has two parts. The first part is to reduce the costs for each purchase, and the second part is to reduce the number of purchases. We're going to start with the plan to reduce the cost of each purchase for healthcare products and services. As we said, the demand for healthcare is not negotiable for our plan. We are planning for it to only increase. However, the supply for healthcare's products and services is negotiable, and if we can increase the supply faster than the demand for them, we can drive down their prices, their costs. Where does the supply for healthcare products and services come from? While we said Medicare and Medicaid are the two primary places the government spends its healthcare costs on, actual healthcare costs come from doctors and nurses, medical equipment, and medical facilities and drugs. If we can have an average annual increase of doctors and nurses that equals 2% more than the projected healthcare inflation rate for the next 10 to 20 years, why shouldn't we expect their costs per each of them to decrease? Based on our understanding of supply and demand's impact on pricing, this should be true. Doctors and nurses use medical equipment. If we can have an average annual increase in the supply of medical equipment that equals 2% more than the projected healthcare inflation rate, why shouldn't we expect their costs per each piece of equipment to decline as well? And doctors and nurses and their medical equipment need a medical facility. If we can have an average annual increase in the supply of medical facility space that is 2% more than the projected inflation, why shouldn't we expect its costs to decline as well? And drugs. If we can increase their supply 2% more than the projected inflation rate, why shouldn't we expect their costs to decline as well? The goal of our plan is to increase the supply of medical products and service providers by an average annual rate of at least 2% more than their projected inflation rate for the next 10 to 20 years. So, that's a big goal. How can we achieve it? Let's start by first taking a look at doctors and nurses. People have two choices for their medical treatment. They can make a doctor's appointment, or they can go to the emergency room, the ER. In 2015, there were approximately 137 million ER visits to all of the hospitals in America. 39 million of those ER visits were injury-related. 12 million of those ER visits resulted in hospital admission. 2 million of those ER visits required critical care. That totals 53 million out of 137 million visits. What were the other 84 million visits about? It's possible many were visits from people without insurance, but not all of them. Many were those in-between visits, the kind where people are just not sure if they can wait to make an appointment with a doctor. And that's what going to the doctor is about for most people: waiting. Making a doctor's appointment is all about waiting. When making a doctor's appointment, many people are fortunate to be able to see a doctor within a couple of days. Many people have to wait weeks for an appointment, some people even longer, particularly for specialists. Once there, you're waiting in the waiting room, sometimes for a while. Then, you go to the examination room, and sometimes you're waiting in the examination room longer than you waited in the waiting room. Then, you're waiting to schedule a test, or take a test, or get back test results. Or you're waiting for your prescription, or to schedule another appointment, or just waiting to go home. This leads us to thinking, though, about this question. Just how many doctors are there? As of 2017, there were approximately 892,000 active licensed physicians serving a national population of 325 million people. That's one doctor for every 365 people. And the number of patients per doctor gets greater for the different types of doctors needed. For an adult doctor, referred to as internal medicine, there is approximately 2,800 patients per doctor. For children, referred to as pediatricians, there is approximately 1,500 children per doctor. For women, there is approximately 8,000 patients per doctor. And the more specialized the doctor, the fewer doctors there are per patient. And for the types of doctors older people need, there are even fewer doctors per patient. So, how many doctors should there be? In April 2018, a report called The Complexities of Physician Supply and Demand, Projections for 2030, concluded that demand for physicians will continue to grow faster than supply. And because physician training can take up to a decade, a physician shortage in 2030 is a problem that needs to be addressed now. If there is no increase in the number of doctors by 2030, you will have one doctor for almost every 400 people instead of 365 people in 10 years, almost 10% less doctors per patient. Remember that while new doctors may come into the profession, many are also retiring. We will need to increase the number of doctors by 72,000 in the next 10 years just to maintain the ratio of one doctor for every 365 patients, and another 50,000 more doctors 10 years after that. This does nothing to lower their costs. Their costs will continue to increase because of inflation. If we can increase the number of doctors to 1,500,000 by 2030, we can reduce the ratio of patients to doctors down to one doctor for every 240 patients. And if we can increase the number of doctors to 2,300,000 by 2040, we can reduce the ratio of patients to doctors down to one doctor for every 160 patients. These types of increases will significantly reduce their costs and increase the level of service people receive. Although this may sound like a lot more doctors, when you consider the different specialties, especially those most needed by people aged 65 and older, there's still many more patients than doctors. We're still a long way from having too many doctors, but having more doctors will make the quality of healthcare people receive much better, and it will also reduce the costs per doctor. But where will all these doctors come from? How do you get more doctors? Becoming a doctor is hard. It takes a lot of time and effort and money. If you want to have good doctors, you don't want to make it easier for people to become doctors by spending less time or effort, but you can make it less costly. How can you make it less costly to become a doctor? You can offer people a tax credit for the money they spend to become a doctor. What's a tax credit? A tax credit is a credit that can be used dollar for dollar against a tax liability. If you owe $1,000 of taxes and have $1,000 of tax credits, then you will have no tax liability. The government can give tax credits to people for all the educational costs they incurred to become a doctor, and they could use those tax credits against their future tax liabilities, but only after they've qualified to practice in the medical profession. Tax credits for educational costs to study medicine can be given for tuition, materials, modest housing, but most importantly, interest on any debt incurred to pay those costs. Receiving tax credits for interest paid on debt to finance a medical education will make medical students very favorable loan candidates to banks, and it would be a great way to finance the costs to increase the supply of doctors. In addition to tax credits to become a doctor, any income earned for providing medical services should have no tax liabilities. Some people might say that's not fair. What about me? Why should a doctor not have to pay taxes, but I do? Why not just do this for everyone, not just doctors? It wouldn't make sense for the government to do this for all people, in all professions, but it makes perfect sense for this profession. We will show why shortly. How do I benefit from doctors not paying taxes? You benefit by having more doctors available to you, resulting in better medical service and care. You benefit by the government not going broke from healthcare costs. Our goal is not to make doctors rich. Our goal is to increase the supply of doctors. Having no income tax liability for providing medical services is a great incentive for more people to become doctors, and for more doctors to come to America, and for more doctors to keep working and not retire. All you have to do is look again at the disparity to the number of doctors to patients to see just how many more doctors our country will need in the next 10 to 20 to 30 years for people to receive greater attention to their medical needs, and for the government to reduce its spending on health care. The government should set standards that people have to meet to earn this tax-free income, and practice in the medical profession and continuously push these standards higher. The government should provide a platform for licensing, education, and continuing education for medical service providers. That platform should be rigorous. It should show records of performance and patient service reviews that should be transparent and available for all to see. Any dereliction of duties or conduct should put at risk their ability to continue practicing in the medical profession and receiving these financial benefits. Everything described for doctors applies to nurses as well. Again, our goal is not to make doctors rich. Our goal is to increase the supply of doctors and nurses and reduce their costs. Doctors and nurses use medical equipment. Here's a sample of just some of the types of medical equipment they use. In 2018, there were an estimated 12,000 MRI machines in the U.S. The average cost for an MRI was $1,000 to $5,000. If there were 25,000 or 50,000 MRI machines, with radiologists to support them, is there any reason to think an MRI wouldn't cost a lot less? How can the government motivate medical equipment manufacturers to sell more machines and lower their prices? It can do this by reducing the motive for higher prices and introduce a motive to sell more units. Any company or business is naturally motivated to sell as much of their products as possible, for as much money as possible. Then the government looks to tax the company on its profits. Our idea is for the government to tax medical equipment manufacturers by using tax rates based upon the volume of units sold, not the revenue for the units sold. As more units are sold, their tax rates decline. This gives a company an incentive to sell more units and lower prices. In addition, deductions can also be based upon units sold. As more units are sold, more deductions become allowable. Deductions can apply to specific products. The more products that are sold, the more deductions become available to the company. Separate the revenue of any product you want more of sold from any other revenue the company may produce. This offers medical equipment makers motivation to sell more of their products and lower their prices. Our goal is not to make medical equipment manufacturers rich. Our goal is to increase the supply of medical equipment products faster than the demand for them. We want to achieve this goal for these reasons. We want to reduce the costs of the healthcare services to people. We want to increase the quality of healthcare services people receive. And we want to reduce the financial liability of healthcare costs to the government. Doctors and nurses and medical equipment need medical facilities. These are what are considered medical facilities: acute care hospitals, behavioral care facilities, outpatient healthcare centers, ambulatory surgery centers, medical centers, rehabilitation centers, long-term care facilities, medical offices, laboratory facilities, radiology facilities, dialysis facilities, and healthcare clinics. Because the costs associated with operating and maintaining these facilities are transferred to the patient and the insurance companies, and then to the government, no government tax should be applied to any revenue for any of these facilities. The increased supply of doctors and nurses and medical equipment and patients are all creating more demand for medical facilities, so the supply of medical facilities should also be increased. Medical facilities are either owner-occupied by a medical service provider or rented out by an investor called a landlord. Eliminating tax from any revenue from medical facilities will help increase their supply because investors will be looking to create more real estate for them, and it will also help reduce the expenses of the medical service provider, whether they're the owner or just renting the space. This will help both increase the supply of medical facilities and reduce their operating costs. Almost everybody in America still has to use transportation to get to their medical facilities. Our goal is for many more people being able to walk or need less transportation to get to their nearest medical facility. Drugs. To create new drugs requires money. Once a drug company makes a new drug, they have what's called a patent or copyright claim on it. This means no one else can sell or make the drug without their permission, up to a certain period of time. While they're the only ones making and selling the drug, there's no competition or greater supply for that drug, and they can sell the drug for as high a price as people will pay for it. Drugs that are sold by companies other than the company that developed the drug are called generic drugs. The company that developed the brand name drug can continue to sell the drug and compete with the generic drug companies, and they may also receive royalty payments from the generic drug companies selling the drugs they developed as well. How can the government motivate drug manufacturers to lower their prices? Instead of giving brand name drug companies incentives not to allow other companies to sell their drugs, they can offer brand name drug companies incentives to increase the amount of their drugs being sold, as well as the number of generic drug companies selling the drugs they created. We can apply the same principles as we did with the medical equipment companies to the drug companies, with one additional feature. When determining the number of units sold for a specific drug, the brand name drug companies can include and add the number of units of their drugs sold by a generic drug company. This will increase their unit sales even higher, providing them with even lower tax rates and larger deductions. For the generic drug company, it would simply be the number of units they've sold. For deductions, the same principle would apply. The more units that are sold, the more deductions they can have. Our goal is not to make drug companies rich. Our goal is to increase the supply of drugs being sold to reduce their costs. Taxes and doctors and nurses and medical equipment and facilities, and drugs. Here's a summary of the 6 tax ideas I just presented. 1. The first idea is to give tax credits to offset all expenses to become a doctor or nurse. 2. The second is make any income earned for providing medical care tax-free. 3. The third is to offer declining tax rates to medical equipment companies as more of their medical equipment is sold. 4. The fourth is to offer increasing amounts of deductions allowed to medical equipment companies as more of their medical equipment is sold. 5. The fifth idea is make tax-free any income earned for any facility providing medical services. Sixth, the sixth idea is to offer declining tax rates and increasing amounts of allowable deductions to drug companies as more of their drugs are sold. And most importantly, brand name drug companies may include in their sales any generic version of their drugs sold with their own sales numbers. Now, some people may consider these ideas too radical and will not agree with them. We will now offer an explanation as to why they should be considered and why they are not radical ideas. Please remember, our goal is to increase the supply of all the medical product and service providers at an annual rate greater than the inflation rate. The first reason for this goal is to reduce their costs to people, insurance companies, and the government. The second reason is to increase the quality of medical care and service available and provided to all of the people in America. But are we giving away too much? What about everyone else? Why should just the medical industry get these tax benefits and not anyone else, or everyone else? In 2018, the government received $3.3 trillion of tax revenue. How much of that money came from the healthcare industry? We're going to take an estimated guess by using the percentage value that each industry represents to our economy, by using the S&P 500 stock index and the percentage that each industry represents in it. We're going to apply the percentage breakdown by each industry to this chart. Using this breakdown, we see that the energy industry provided 5% of the tax revenue, industrial companies 10%, the financial services industry 13%, the technology industry 21%, and the healthcare industry 15%. Why do we treat the healthcare industry different than other industries with these tax ideas? Because, for our plan, the government is accepting ultimate responsibility for everyone's healthcare needs. There's no other industry that impacts people's lives or the government's finances like healthcare. 15% of $3.3 trillion is $500 billion. $500 billion is the number we're going to use to estimate how much the healthcare industry contributed to the tax revenue in 2018. What number should we compare this number to? If we compare the $500 billion received from the healthcare industry to the $1.1 trillion that was paid to the healthcare industry in the same year, we see a financial plan where each time the government receives $1 from the healthcare industry, it has to turn around and give back $2. Each time the government collects taxes from healthcare products and service providers, those costs go back to the people, then to the insurance companies, and then back to the government. If each time somebody gave you $1, you had to turn around and give them back $2, how long would it be before you tell them to stop giving you $1? Probably not too long. Our plan is designed to turn this around. The first step to reducing healthcare costs to the government is for the government to stop taking money from the healthcare industry, but not to just stop taking it by using tax incentives to increase the supply of the providers. Our plan is to reduce the government's financial liabilities for healthcare by increasing the supply of healthcare products and service providers. If we can increase the supply of medical products and service providers by an average annual rate of at least 2% greater than the inflation rate for the next 15 to 20 years, all of their costs should be greatly reduced over time. This helps us accomplish part one of our two-part plan, which is to reduce healthcare costs to the government and increase the quality of care and service people receive for their medical needs. Now that we've identified the plan to accomplish part one, which was to reduce the inflation costs for healthcare products and services, we're ready to identify a plan for part two, a plan to reduce the number of purchases of healthcare products and services the government is paying for. Now, we're ready to talk about health insurance. Health insurance is going to help us accomplish part two of the plan by reducing the number of purchases of healthcare products and services the government is paying for. Insurance companies are in the business of risk transfer, financial risk transfer. Insurance companies use something called the law of large numbers to figure out how much financial risk they can take on. The law of large numbers say that the more people of the same type, for example, age, gender, ethnicity, industry, location, and so forth, the more predictable are the outcomes for specific coverage. This allows the insurance companies to try and determine more closely the amount of premiums and deductibles and copayments they can afford for covering a specific condition. When an insurance company decides it cannot afford to take any more financial risk, it can transfer additional risk to other insurance companies. This is called reinsurance. Insurance companies can provide a valuable service to the government. Insurance companies can help the government reduce its healthcare cost liabilities by being a source for reinsurance. Medicare already transfers some of its financial risks to other insurance companies. For example, prescription drug coverage is provided by private insurers through Medicare's Part D program, and Medicare Advantage plans are also provided by insurance companies. The government should be expanding the supply of healthcare insurance providers in order to transfer more of the financial risk and liabilities from Medicare and Medicaid and the other programs too they are responsible for. The U.S. insurance industry currently has over 1,000 life and health insurers that hold approximately $5 trillion of assets. In 2018, only an estimated 180 insurance companies were providing health insurance coverage to people through Obamacare. Insurance companies should be given financial incentives to insure more people in exchange for taking their financial risks. Insurance companies are in the business of providing insurance. With additional financial incentives, they will find ways to insure more people. One of the first incentives the government can give to insurance companies to provide more healthcare insurance to people is to increase the supply of medical products and service providers. This is because lowering their costs will also lower the insurance company's costs. Who do the insurance companies pay claims to besides the insured? Doctors and nurses, medical equipment providers, medical facilities, and drug companies. Then, the government should give tax incentives to the insurance companies for the more people on Medicare and Medicaid they insure. The more people an insurance company provides Medicare or Medicaid insurance for, the lower their tax rate should be. Probably the two biggest complaints against insurance companies are their customer service and claim denials. The government should allow more deductions for the more claims that are paid. The government should allow the insurance companies to use these tax rates and deductions against other lines of insurance they may also provide. This will give additional incentive to health insurance companies to insure more people and pay claims faster. This will also give incentive for other insurance companies not already providing health insurance to consider doing so as well, and further increase the supply of healthcare insurance providers. The more insurance companies there are competing for customers, affordability and the quality of customer service should both improve a lot. Also, the operating costs for healthcare service providers should also improve as insurance companies look for more ways to find new customers, also known as patients. They will also have incentive to pay claims faster instead of looking for ways not to. Our goal is not to make insurance companies rich. Our goal is to increase the supply of insurance companies providing health insurance. The reasons for this are to reduce healthcare costs to the government, reduce healthcare costs to the people, and increase the quality of healthcare services people receive. The government currently provides healthcare insurance to 38% of all Americans. The goal for our plan is to reduce that number, not increase it, as much as possible. What about Obamacare? The Affordable Care Act has been successful in helping more people get health insurance. In 2018, an estimated 11 million people were getting health insurance through Obamacare. However, Obamacare is not the only way or the best way to help more people get medical insurance for the following reasons. Most people are already motivated to buy health insurance. Many just simply didn't have access to it. Obamacare created an insurance exchange that has been helpful for providing a central place to shop for health insurance. However, it also puts a lot of mandates on insurance companies to be able to offer insurance on it, and even those not on it. This has reduced the supply of possible insurance providers, and one reason why Obamacare is not helpful to our plan. Obamacare also applies a 2.3% medical device tax on medical device companies producing products whose costs we're also trying to reduce. This also is not helpful to our plan. For these reasons, Obamacare is not part of our plan. There are some people who would like to see Medicare as a single-payer insurance system that can be extended to cover the entire country. They would like to ban duplicative private insurance for Medicare and raise taxes and cut payment rates to medical providers. An argument they make for this is that Medicare's size lets it negotiate better prices with doctors and hospitals. This is called price control. Price control by the government will ensure the supply of healthcare products and service providers will not keep up with the increased demand. Price control ensures people will receive lesser quality of care, and financial liabilities to the government will also increase. Medicare could get better prices if there were more doctors and hospitals and medical equipment, not less insurance providers. Being able to provide affordable health care to all the people for a long period of time requires America to become financially stronger. The government and the private sector must work together to accomplish this. America can't help all Americans receive high-quality, affordable health care for very long if it cannot stay financially healthy itself. Our goal is to provide high-quality, affordable medical care for everyone using a system that is sustainable. For these reasons, Medicare as a single-payer insurance system is not part of our plan. The government currently provides healthcare insurance to approximately 38% of all Americans. There are 7 major government healthcare programs providing healthcare services to over 1/3 of all Americans. They are Medicare, Medicaid, the State Children's Health Insurance Program, the Department of Defense TRICARE programs, the Veterans Health Administration, the Indian Health Service Program, and Obamacare. To provide incentives for more insurance companies to share the financial risks for providing health insurance, there should be no requirements or mandates for what conditions the insurance companies need to cover. Insurance companies should be given financial incentives to insure more people, not less. Insurance companies should also be given incentives to pay claims fast. Even with all of these tax incentives, insurance companies won't insure everyone, and they shouldn't have to. It's the government's job to make sure everyone is insured. That's what this plan is for. Insurance companies shouldn't be mandated to provide certain types of coverages. The government can insure the people the insurance companies won't. Every person an insurance company provides coverage for is one less person the government should have a financial liability for. That helps us accomplish Part 2 of our plan to reduce healthcare costs. And for those the government does insure, the government will have a much larger supply of doctors and nurses and medical equipment and facilities and drugs to lower its remaining costs even further. Remember, the government currently provides healthcare insurance to approximately 38% of all Americans. To accomplish Part 2 of our plan, the government needs to reduce the number of people it needs to provide insurance for, not increase it. Increasing the supply of insurance by increasing participation by insurance companies will reduce the number of purchases the government has to make for healthcare. Increasing the supply of medical products and services providers will also reduce the costs of those purchases the government has to make for healthcare. We now have a plan to reduce both the inflation and the spending of medical products and services the government has to spend on for healthcare. Our goal is for all people in America to have access to a higher level of medical care and service than they currently have today, and for a lot less cost than the current projected costs. This plan is a way to accomplish this. In summary, the goal for this video was to offer a long-term healthcare plan where every person in America in need of medical care is treated with dignity and compassion and given personal attention regardless of their social or economic status, while at the same time, ensuring America's healthcare system becomes an asset to America instead of a financial liability. To do this, we said the government needs to help increase the supply of medical products and service providers by approximately twice as much as there are today in the next 10 to 15 years. That's doctors and nurses, medical equipment and facilities, drugs, and insurance companies too. We showed why this is and how this can be done. If you believe now this healthcare plan is what you want, it is up to you to let our elected officials know. I couldn't think of a better issue to give all Americans the opportunity to come together on and work together on than providing affordable, high-quality health care to every person in America and making America financially stronger while doing so. If you want a health care plan whose goal is to have no more waiting and to have a doctor with you or your loved ones a little longer before running off so fast to the next patient, that's what this health care plan is striving for. To do so, the American government actually needs to spend less money on healthcare, not more. It needs to promote the supply of healthcare products and service providers and work together with the private sector, not dictate price controls or give mandates, or try to run the entire system. And it needs to stop borrowing so much money. Let our elected officials know you have a plan to reduce healthcare costs and increase the quality of medical care for all the people in this country. And let them know you will use the power of your vote to implement it. Thomas Jefferson said, "We do not have government by majority. We have government by the majority who participate." If you want this health care plan for America, then forward this video to our elected officials and let them know. Let them know you have a plan to provide affordable health care to all Americans.